Union of Mineworkers, together with the Africa Civic Education Foundation, have come together and launched a new civic education program that is specifically focused on tackling gender-based violence and femicide in the mining sector as well as related industries. And as GBVF continues to impact various communities right across South Africa, the mining sector is not an exception, facing ongoing incidents of abuse, harassment, and even the murder of some women. Now, this new initiative aims to address those challenges directly by promoting prevention, awareness, as well as behavioral change within workplaces as well as communities. And for more on this, let's extend a very warm welcome to Dr. George Peta, who's the Chief Executive Officer of the Africa Civic Education Foundation. Dr. Peta, it's a great pleasure having you with us on the show, so welcome.
Thank you so much. Good to be here. Thank you so much for the opportunity.
It's great to have you with us. Talk to us about this great initiative. How did it come about and what are some of its key objectives?
Gender-based violence continues to be a problem for society. Over years we have seen people raging up, with anger because of the things that have been done to women and children. But in the main, you hardly come across solid, programs to mitigate, especially the preventative side of things, to prevent this problem from spiraling even into our future. That was the starting point for me and for ASF to start conceptualizing and developing this program, which is a preventative program. The National Strategic Plan on GBVF, mandates all of us, every sector of society, to develop programs, especially preventative programs.
It's a social responsibility.
So we started there to conceptualize and develop programs and develop learning material that we have here, so that then society can have something to use in educating society. Because for us, this is about human character, human perspective and attitude. And you can only change it through civic education. And that was the driver behind where we are and the things and the material and the program that we developed up to so far.
Talk to us about your rollout plan, because this sounds very interesting, Doctor. I mean, we're always hearing that, of course, we need to start teaching our kids now. GBVF has become such a pandemic. We need to start teaching it at grassroots level, because some of these young ones are growing up exposed within these families that are either substance abusing or are committing GBVF atrocities. So let's talk about how exactly you plan to roll this out to ensure it's a preventative part of solving the problem.
Alicia, you're right. Every sector is affected. The basic education sector, as a solid, sector in the education fraternity, is a sector that we cannot look away from if we really want to drive impact.
True.
Because it's about socializing and re-socializing our people, starting with the younger ones. So our strategic plan, really, it's about going into the department, going into that sector, start speaking to the stakeholders. For example, we are in talks now with SATU, the South African Democratic Teachers Union, to say how can we partner, how can we take this process into the Ministry of Basic Education. Yeah, but currently we're also rolling out this program within the TVET college sector.
Okay.
A number of TVET students and employees are being assisted through this program in terms of the civic education component of it.
Okay, so what does it comprise of? You give them books, you give them education?
We give them books. This goes through a number of modalities, but in the main, it's educational workshops. So we're going through, we're taking them through educational workshops, either a day or two, depending on the situation of the sector in which we do this thing at a time. So part of the process then is for our participants to be given these booklets that we're using as our educational tools.
It's written Ubuntu.
Yeah, it's written Ubuntu. This is one central pillar of us as humanity.
True.
Yeah, but the booklet then covers a number of subjects. So we're giving them these booklets, as a self-help resource for them to take away and remind themselves every time of, but what is the ideal, life of humanity?
True.
How am I supposed to conduct myself? How am I supposed to, affect the people around us? We're covering a number of subjects in this thing. We begin by saying, but what is this animal that we're talking about, GBVF, so that people can understand what it is, how does it manifest, what are the tendencies that one can see that they are likely in trouble? We're addressing the issue of Ubuntu. And the question really that we are raising in terms of Ubuntu.
You can turn the book around, Doctor, so we can see. Yes.
I usually raise the question of, but are we still really true humans? Because the things that have been done to women and children today, they suggest
Inhumane.
to a great extent that we have lost our humanity. You know, allow me to say this. Either our humanity has been infiltrated or we have lost something out of our humanity. And the only thing for us to do, among others, in the main, is to go and seek for that thing which we have lost as humanity. We need to now introspect and say, what is this thing that has infiltrated us, so that we can take it out of our system? Then we go back to being human beings again.
Go back to the grassroots.
If there is one thing and if there is one place that we have lost, but to our own detriment as society, that is the place called Ubuntu. And for me, that is the place that we need to go back to.
Absolutely.
There's no other ways. We're touching on subjects like human trafficking, context of intimate relationships as well, alcohol and substance abuse and misuse, and ultimately, the broader context of human coexistence. But also very important, the issue of psychosocial health, in terms of spiritual health, which is about, a life of principle.
True.
Emotional health, which is about the consciousness about how am I to affect other people with the things I do and the things and the way I think. Social, intelligence and social wealth, which is about I am part of humanity, and humanity and society are part of me. So how am I supposed to affect other people? And ultimately, mental health, which is about the mental and psychological, stability of people. Because in the main, sometimes people do these horrific things because of, the pressure that comes with their mental and psychological pressures. So we cover those subjects. But in the main, I would say to you, Osalicia, anyone can destroy this material, but leave one chapter for me, and that is the chapter on Ubuntu.
Oh, wow.
Yeah.
Doctor, wow. Yeah. And also, we're always hearing conversations about leaving boys behind. And I suppose you have said, not in your name, you're going to lead from the front. And we really appreciate that, Doctor.
Sure.
Unfortunately, we're going to leave it there because we are really out of time. But best of luck with this great initiative. If you can leave some of these booklets for us also here in studio,
we will.
We'd really appreciate
we will.
that.
And thank you so much. We're looking forward to penetrating every sector and collaborating with every partner in every sector so that we can take this mission forward. Thank you so much.
Good luck, Doctor.
Okay.
Thank you so much. Great initiative there in conversation with Dr. George Peta there, who's the founder, of course, of the Africa Civic Education Foundation, on their collaborative efforts with other organizations in fighting the scourge of GBVF.